Welcome to the Let's Talk Mental Health series brought to you by Masiviwe, a movement for mental health. My name is Andile Maposa, and I am your host for today. The Masiviwe movement is a group of organizations led by the Foundation for Professional Development, working together to make sure that everyone is heard when it comes to mental health. Today, we're going to be talking about the mental health of healthcare workers. We're joined in this episode by Dr. Garth Japhet, a medical doctor who started Soul City and is the CEO of Heartlines. Welcome, Dr. Garth.
Hi, Andile. Good to see you.
Thank you. Thank you for joining us. First up, Soul City. I'm sure many people who are my age know that show. You are the one who started it?
I am indeed. Yes. In my younger years, as a young doctor working in Alexandra Clinic in the early 1990s.
So you are definitely the best person to come and help us unpack just the mental health of healthcare workers, the people who take care of us. So Masiviwe has produced a series of short videos on a number of issues in the mental health space, and we know that healthcare workers are under a huge amount of strain, especially in South Africa when it comes to their mental health. Before we even get into watching the first story, what's your take on the state of the mental health of healthcare workers in South Africa?
Yeah, thanks, Andile. I mean, it's obviously you can't make a blanket statement, but the reality is that many people are working in under-resourced clinics or hospitals. They're seeing far too many people with not enough resources, and that, by definition, puts people under huge pressure. Clearly, different people work with it differently, but I would say that a lot of health professionals deal with burnout simply from the burden of illness and not enough time and too many people.
And on that note, let's take a quick break and watch this video, which talks of Dr. Zolelwa Sivumba, who relates how getting TB while she was training to be a doctor impacted her mental health. Let's watch this.
My name is Dr. Zolelwa Sivumba. I am trained as a medical doctor, but I am currently in clinical research. Why I wanted to be a doctor. So, my father is a doctor. I love the idea of helping a person. Starting off at medical school was very exciting. Every year, the second years are taken to a TB hospital, and they don't really provide N95 respirators for us. I don't remember them being provided when I was in second year. I was working in the wards, and a couple of weeks later, I developed a lump on my neck. Went to the hospital. The doctor put a needle in the lump. I was called, and over the phone, I was basically diagnosed with multi-drug-resistant TB and told to visit my nearest clinic. I had to get daily injections for 6 months, but I ended up getting a port because the injections were just so painful. I wasn't given any psychological support at the clinic. I kind of just had to make my own way. I stopped taking my medication for my depression and my anxiety because I already had a very high pill burden. I was taking 21 pills. I was sure that I wasn't going to make it. I even had a plan of what I was going to do to take my life. And so when I did finish treatment, it was very strange. Still be alive. Sadly, I knew I had to go back to med school because all I had was my matric. But I was afraid of the system that just clearly doesn't really care if I fall ill and is not going to do things to protect me, is not going to help financially or any other kind of way to actually see me get better. I graduated and it was an amazing day. Didn't think I was going to finish because of the TB, but I finished and now it's time to be an intern. I really struggled with a lot of anxiety during my junior doctor years. People just arrive at work not okay, and then they end up taking it out on other people. Time to see a therapist. Where? Because you're at work from 7:30 until 5. I got into a car accident after a 36-hour shift at work. I fell asleep at the wheel, probably, after that 36, because I had 30 minutes of sleep in that 36 hours. I did go for some trauma counseling, and it really did help. And it made me realize, it made me question why we don't get trauma counseling, just in general. Essentially sending people who you haven't taught the soft skills that are required to deal with that. And then we experience those things, and then it's also hard for us to say that we need help for fear of many things. They could say that you're a danger to the patients. They could say you can't practice anymore. So you just keep it in. My dream is, to help the health system become more people-friendly towards the health students and workers. But I realized that I couldn't do that while inside because I'm going to be treated badly for it, which is sad. So there's just not enough care for us. We also struggle, for some reason, to care for ourselves. Everybody knows that the health system is crumbling and it's bad, but we literally feel it from inside the health system. So we're panicked too. I eventually left the front lines. I realized that nobody really cared about the health worker. I needed counseling. I needed to eat properly, like a proper nutritious diet, to have time to myself. Beyond it being just our mental health that's not cared for, for me, it's our general health. We've kind of taken on this role as the giver of health, and we forget to identify ourselves as worthy of receiving help too. And I'm not just talking on behalf of just the doctors. Anyone that works in a health facility, you just lose that care that you felt in the beginning. You're going to deal with human suffering. So why are we not talking about human suffering?
Garth, when we combine the stress of getting TB with the stresses of being a medical student, that seems like quite a load to carry. What other stresses and strains are there that we don't really know about when it comes to training to be a doctor?
Yeah, I think the medical training by and large, I think it's improved, but doesn't prepare young people for these stressors and strains. Dealing constantly with sick and dying people, often a major trauma when you're only 18, 19, 20. Plus, as the doctor was exposed to the potential of getting a communicable disease like TB, is not something that is people really talk about or trained about. I think, the emphasis on medical training is transfer of knowledge and skills. It's very little on how you as a person deal with these different sort of stressors and strains. So I don't think we're preparing particularly well. I think it's improved, certainly since I qualified. But I think also the stresses on young people who are qualifying as doctors have increased exponentially, not just because of the patient load and lack of facilities, but also because a lot of the administration of the places that they're working in is dysfunctional. So you're not getting the support of the administration of the things, drugs being delivered on time, equipment that doesn't work. These are all incredibly stressful things when you're trying to do your best as a healthcare worker.
Now, you I don't know, I should say were a doctor, are a doctor, but you've certainly worked within the healthcare space. How would you ensure that when you leave work, you don't carry all that stress with you when you go back to your family?
Well, although I haven't practiced clinically for a while, my wife is a clinical doctor, so I experienced that firsthand as her partner. And I think one of the key things is that she's able to talk to me. And obviously, because I have a medical background, I'm able to listen and to understand. So I do think that being able to talk to somebody else, potentially with some sort of background in medicine or clinical psychology, somebody who's got a bit of insight into what you're going through, is really important. And I think, unfortunately, a lot of doctors and healthcare workers don't have that person to debrief with. So although you may want to leave your issues at the hospital door, I think by and large it doesn't necessarily go away. So to debrief on a regular basis about what's happening, is I think probably the quickest way to improve a sort of coping mechanism of getting perspective. Because when we talk things through, we often get a bit of perspective on what has happened.
And it's great that you mentioned talking things through. To anyone who's maybe watching and is a medical student, there is a toll-free line for you that is run by SADC 24 hours a day. And you can call and you can actually do what Garth was talking about, which is debrief and talk to someone who has a bit of background and can understand what it is you're going through. The number for that is 0800 323 323. 0800 323 323.
Growing up, my mom is a nanny. She worked for a family that both worked in the medical field, a paramedic and a neonatal nurse. So I always aspired to be like them. What I envisioned becoming a nurse would be like, as all health professionals would say, helping people. I care about people. So I thought it was that, but I realized it's beyond that. It's being there for a patient holistically, physically, emotionally, spiritually, and then walked into a world of COVID, being this young professional in my community service, having to be one of the people that are in the forefront, fighting COVID and seeing all of that scary stuff, because one envisions the concept to be a year where you balance, you're just basically learning how to walk into nursing. And we didn't have any of that. We would get about 2 professional nurses in a unit dealing with about 50 patients a day. And we had to step in the shoes of a full-on professional nurse, not just a community service nurse, leading a shift and taking all those hours, having to work extra hours just so that we could ensure that our patients are met and kept safe. You come back home, you're removing all this PPE that you're wearing. You barely get to see your loved ones. So that was a very tough time to actually walk into this field, putting so much of our patients' needs before our own needs and not realizing how much that was swallowing ourselves. I know at some point, just post-COVID or towards the end of COVID, I did experience burnout, and I realized that I just didn't have the urge to wake up and go to work. I wasn't as excited, to go to work. Then you eventually realize that you're actually tired emotionally. You haven't dealt with all these emotions. You come back home to think about what could I have done to have changed that patient's situation. I've got a good support system. My husband is also in the medical field, so we started then talking more about what we experienced at work so that I could actually be able to express to someone that would understand, because the public never understands how we're basically feeling and what we're going through, how it feels like to be overworked, I started seeing a psychologist as well. And that helped a lot with actually getting help, because at this point in time, I realized that if I don't get my mental health fixed and sorted out, then I won't be able to help other people. Nurses usually don't get help because we are the ones that are always seen to help people. I guess it's also never having time. You're working in such terrible conditions and you're still expected to be fully functional and mentally okay every single day. And it's difficult to have to do work of 5 people as one person. I think if there could be better support structures for nurses, support groups that sit down and then people getting to hear from our side as well what we are going through. To the nurses that are out there, I do believe that we can't pour from an empty cup. So we need to be fine first. We need to take care of our mental health first so that you can actually go up to that patient that is in need of you, and then you're able to provide for them fully because now you have taken care of your mental health.
Now, Garth, as someone who's close to healthcare workers, what would you say to the public about understanding the stress that healthcare workers are under, especially post-COVID?
Yeah, look, COVID was a very tough time for healthcare workers. And that first of all, they were dealing with a disease that we, at that point, and we still clearly don't understand it completely. But there was the threat of possible disease and death constantly. And as we know, a lot of healthcare workers did die. So you deal with that for a long period of time. A lot of people were sitting at home. But in that time, those people were in wards, were in hospitals. And the stress of that, I think, you talk about a war. It was very similar. I walked into a couple of COVID wards, and to see people literally gasping for breath and, often dying, it was hugely traumatic, and wondering through that time whether you'd be the next person to get it. So, I think the general public probably didn't understand that. And I think the thrust to get people vaccinated was so intense from many people in the medical profession, because we were seeing what was going on, and a lot of people just didn't see that because they weren't inside hospitals.
Thanks for that. Now, our final story is about Dr. Tlali. He shares his experience of losing a patient and other difficult circumstances during COVID. And he also tells us about using unhealthy coping mechanisms such as alcohol. Let's watch that. And as soon as we get back, we will just talk a little bit about some of the unhealthy ways people try and cope with stress.
Funny story, when I was a kid, I was very scared of police, as our parents would always frighten us with police if we're misbehaving. So for the longest of time, I wanted to be a policeman because I wouldn't go to jail. And my aunt said to me, no, be a doctor, you'll never die. And I think that's where the dream kind of began. I thought it would be easy. I thought I would have a lot of money. In reality, being a doctor is a lot of hard work. It's a lot of pressure, a lot of responsibility, and it is a privilege. I moved on to do my ComServe at a community health center in Tanzania. When the pandemic started, I was the main person, working in the COVID side. There was a time when we did not have enough testing kits. There was a time where we did not have enough staff. When the waves got worse and people started dying, we ran out of oxygen. At the peak of our resources, we could probably have 10 people on oxygen. There was a time we had a very sickly patient who was brought in while I was seeing another patient, right? And as she was being wheeled past, I kind of saw that she looked a little bit floppy. So I just excused myself from the patient I was seeing, and I just went to go attend to it. And I asked him to please just put up a line and check the oxygen saturations on her. And she had very, very low oxygen saturations. See that she was peri-mortem. Put her in a private space. We did everything. I tried to get put on an oxygen mask on her. Got an oxygen cylinder, opened it, was empty. Threw it out. Got another one, was empty. Threw it out. Got another one, was empty. So I told one of the nurses that I was working with, please run to casualty to get an oxygen cylinder. For which he did. He ran very quickly and came back. But by the time he came back, it was too late. And, that was the only time I ever lost it as a doctor. I had a breakdown. Yeah, that wasn't a good day. Then I got to a point where I got seriously burnt out. I was very apathetic to my patients, to my job. I was just doing it, and I didn't feel like I had the chance to take a break. The burnout is starting to lead to anxiety, starting to lead to depressive symptoms. But, you put your patients first. You took an oath, right? I did find a coping mechanism, which wasn't necessarily a great one. Somewhere during the lockdowns, the stages, they did permit us to buy alcohol. I think that's what helped me cope. It wasn't healthy. I continued going to work until I got sick. I got COVID. COVID at the time was still a very deadly disease, and it came with a lot of fears and, well, a lot of concerns and stresses. But also I felt, at least get to just get to sleep, get to do nothing. The Healthcare Workers Care Network, which kind of sprung up to give support to healthcare workers who were going through a lot during COVID. And I reached out to them, and I had virtual therapy sessions with them, and that helped me a lot. The first step of getting help is that you need to recognize that you have a problem. And I think a lot of doctors, we don't recognize what we're going through as a problem, because everybody goes through it, and most people seem to cope with it. And the important word is seem. You are afraid that you will be deemed incompetent or not good enough. Why are you struggling? Look, we're all going through the same thing. Everyone seems to be fine. Everyone's coming to work. Everyone is productive. And you, why are you struggling? We are creating a generation of doctors that will be traumatized and estranged from family in the future, because you just haven't dealt with what you're going through. We need to normalize going to therapy. We need to normalize talking about our problems. We need to let go of macho Hercules mentality. We need to choose ourselves first, so that we can be able to choose our patients.
Now, Garth, Dr. Hlali at least recognized that he was dealing with burnout, and he eventually reached out for help. How important is it for the healthcare workers themselves to be able to say, okay, I have a problem?
Yeah, I mean, it's critically important, and that's why I think it's always important to have, if possible, friends or in the profession who you can debrief with, who can talk into your life, who can recognize these things, because he certainly is not unique in adopting unhealthy coping mechanisms. The combination of often not being able to sleep because you're so wired, so you take something to sleep and then you can't keep awake, so you get something to keep awake. Then you're traumatized, so you use alcohol or other drugs. You eat unhealthily. I mean, if you've been awake for a huge amount of time, you often end up eating unhealthily as well. So it does require, and that's why I think, the SADC helpline is great, but I think one also should try and be quite conscious about reaching out to colleagues, to be almost mentors stroke companions who can talk into your life, who say, look, Garth, things, you're looking like things are going downhill. You may need to get some help. I think that, the community of healthcare workers is really important for every healthcare worker.
Now, part of the Masiviwe project encourages healthcare workers to go for counseling, but very few of them actually do. Why do you think that's the case? Why such a low uptake?
I think, the type of person that does medicine is often a very sort of driven type A, I've got this achiever type thing. And maybe the sort of, by going for counseling, you're admitting a degree of vulnerability of failure, when you're meant to be the type A, the guy who's got this, or the woman who's got this all together. Unfortunately, the way in which doctors and medical students are chosen is very much from that cohort of people. So I think this concept of admitting failure, which is not something, and it's not failure, we know it's not failure, but in their own mind, it might be seen as failure to actually need help. So I suspect that that's probably high on the list of why a lot of healthcare workers don't go for help.
Garth, thank you so much for your time. That's all the time that we have on today's episode of Let's Talk Mental Health. Remember, you can always go to our website. That's www.masiviwe.org.za to get more tips on how to cope better with your mental health when you are struggling, as well as find help in your area using our interactive map. Till next episode, goodbye.